TAVR is without a doubt one of the great success stories of the last 10 years. We're still learning a lot about it, and we're still learning a lot about the patients themselves and outcomes. There is a paper coming up in the April 22nd issue of JACC. It is on the sex-related comparisons of TAVR and SAVR. And so I'm talking with Dr. Matthew Williams, who is from Columbia University Medical Center in New York and the co-director of the VALVE program there. A great paper, because there was a variety of different things that I didn't know when I read this paper. This is from the partner trial. This is analysis from that, correct?
Yeah, that's correct. This is from the randomized trial looking at surgery versus TAVR in patients that were deemed to be high risk for surgery.
So before you sat down and did the analysis, what were you expecting to see?
Well, we actually didn't know. I mean, what we know historically is that surgery is a higher risk factor in women with aortic stenosis. So, and that actually, one of the reasons that their STS score is higher is because female sex counts against the STS score. So we were expecting maybe they were going to be higher risk.
So what did you actually find?
We actually found that women did better with transcatheter valve than with surgical valve replacement, whereas men did similarly between surgical and transcatheter valve replacement.
So it's optimistic on both sides of it. It's really optimistic for the female patients. Do you have any idea why?
It's hard to say. I mean, I think one of the big things comes down to is the way we looked at the risk is based largely on this STS score. And again, being a woman makes your STS risk score higher. So if you look at the men and the women had a lot more comorbidities. So a lot more of them had coronary disease and were diabetics and had other problems wrong with them. So the women were, in one sense, healthier. And so what it actually appears is that being a woman is a risk factor for surgical valve replacement, but it is not a risk factor for transcatheter valve replacement.
Do you share this with your female patients now?
We do now that we have the data. I mean, we say there is some suggestion that women especially, and it has to be done through the transfemoral approach. There was not a difference if it was done through the transapical approach. But if you're treating high-risk women through a transfemoral approach, they do better long-term, out to beyond 2 years with a transcatheter valve replacement as opposed to surgery.
So what are you going to do next? Are you still looking at any of the partner trial data?
Yeah, sure. We're looking at it, and with the intermediate risk trial, the core valve data has just come out, and the little bit of data I saw in the sub-analysis showed also that women do better with transcatheter valve as opposed to surgery, and we'll see in the intermediate risk trials. The ideal thing would obviously be to do a randomized trial exclusively in women, but that's probably impractical.
Yeah, I suspect you're right. But I think overall, the results tend to be encouraging, because for men it's kind of equal, and for women it's even more so in terms of it's more optimistic with them if they have the less invasive approach.
I think that's true. And, I mean, at least in men, they do well with both, so
exactly.
That's encouraging. And there are certainly some quality of life benefits to transcatheter valve over surgery.
Oh, absolutely.
But in women, it's a pretty remarkable difference.
Now, this is in the April 22nd issue of JACC, so please take a look at the paper by Williams et al. It's a sub-study of the partner trial on the sex-related differences between TAVR and SAVR. For CardioSource World News, I'm Executive Editor Rick McGuire.